Now let's bring in Dr. Anne Rimoin, professor of epidemiology at the UCLA School of Public Health and the director for the Center for Global Health Security. Doctor, good to see you. You know, other countries are enacting mandatory quarantines now for these passengers, but the U.S. is giving the ones in Nebraska, the option to leave the facility and actually continue their quarantine at home. I guess, first of all, I want to ask you, what do you think about that in your opinion? Is that reasonable?
Well, I think that this is a very containable disease. The key here is making sure that you quarantine the people who've been exposed for this extended period of time, isolate people who are sick, and make sure that you track down any chains of transmission. I think that if people can truly quarantine at home, meaning be away from anybody else in the household, have their own bathroom, not have to interact with others, I do think it's possible to be able to do so. And I think what they're doing right now at this facility is really making sure that that is going to be possible during this time, and that these people also will have access to the appropriate medical care should they get ill. Because if they do test positive for this, it's very important that they have access to the right kind of care, given how quickly people can get sick and be in very serious condition.
And just to follow up, what if those passengers, I mean, you would hope that they would practice the proper protocol, but what if they don't and they're being allowed to leave the facility? How much of a risk is this for the rest of the population?
Well, this virus is certainly an infectious disease. It can transmit from person to person. And there are some questions about what kind of exposure, how casual that exposure is, based on the data that's out there. There was certainly an outbreak that was detailed in an article in the New England Journal of Medicine, where somebody did transmit the virus from saying hello to somebody else. What that really entailed, were they kissing on the cheek? We don't, I don't know how close that transmission or that exposure was, but it does mean that people have to take this seriously. They do need to avoid contact with other people, and so my guess is that because they will be checking in daily with public health, that will be able to be achieved. But it really is going to rest in terms of the responsibility on these people to truly quarantine as is necessary.
So there are 5 people currently being monitored in their home states because they were exposed to one of the cruise ship passengers during travel. Why isn't that number higher, in your opinion? Are only people sitting directly next to someone exposed to hantavirus?
Well, these were international flights. And so the question is, who was in close proximity to the case that we're talking about, or cases? And in terms of people who got off the ship, those are the number of people that were on the ship that came back to the United States. This was an international a cruise with 19 different nationalities. So I think that everybody that has been on that ship has been tracked down in the U.S. and those people that were on flights that with the people that actually were sick with hantavirus are certainly being contacted and monitored.
Dr. Anne Rimoin, thank you so much.